to the Gee Ursula Show. Thank you so much for hanging out with us this morning. If you haven't already done so, I would love it if you like and follow us on Facebook. Be part of our community there. We promise it is going to be a very positive social media experience, which doesn't happen often enough, but our group there is fantastic. So throughout the course of the pandemic, we've been doing everything possible to prevent emergency rooms from overflowing with COVID patients and other patients, really. But one local ER is shutting down, not for a lack of patients, but because of a lack of staffing. And our reporter, Nicole Jennings, has been looking into what happened at St. Michael Medical Center in Bremerton. Hey, Nicole.
Good morning.
So they had to shut down the ER. Tell us about that.
Yes, the ER at the Bremerton St. Michael's has closed. Silverdale, which is about 7 miles away, that St. Michael's there still has its emergency department open, and they're redirecting patients to go there. But the Bremerton location, they simply didn't have enough staff for the overwhelming number of patients coming in. As we talked about when I was on the show a couple weeks back, hospitals just all around the Puget Sound, all around the country actually, are just overwhelmed with people this summer for a variety of different reasons, notably people ignoring routine care during the pandemic, staying home instead of getting those screenings, and now having more serious problems that require hospitalization. And so hospitals are just seeing patients coming in droves, and at the same time, doctors and nurses are leaving in droves.
Okay, we're getting some technical issues here, so you're popping in and out, but basically you said it's not just because hospital staff is leaving, but also it's a very typically busy season, and also compounded by the fact that people put off their health care and now they're coming in. So it's trauma season, people put off health care, they're coming in, and now we have people leaving. Why are people leaving the industry?
They are just having severe burnout. I mean, if you can imagine, and I can't imagine what they're going through every day, they have had the most physically and emotionally demanding year and a half since the pandemic started. I mean, they're dealing with severely sick and dying people every single day, long hours, overtime, never getting a break, never getting a moment to just collect their thoughts and relax. And so it takes a toll on a person. And then what I've been told from the CEO of the Washington State Hospital Association is that seeing patients now coming into the ER and the ICU, and pretty much everyone who's coming in with COVID now is unvaccinated, seeing the fact that people refuse to go out and get the cure that is available is just really contributing to the burnout. It's absolutely demoralizing.
Right now, Nicole, can you talk about what's going on, that people right now are having a hard time? They're having trouble getting spots in long-term care facilities after some of this hospitalization. You want to talk about that?
Yeah, it's the same thing. I mean, just a lack of staff. And I've seen this in my own family. The last time I came on, I was talking about my grandpa being in the hospital. It took him a week after he came out of the hospital to be able to have someone come out to the house and help out a nurse, a visiting nurse. It's just a lack of staff all around. I mean, and this is a person who came out of the hospital unable to walk, unable to make himself meals, and it still took a week.
Down in Thurston County also as well, one of the problems right now is the wait time. They're saying there's up to 90 minutes wait time in the parking lot because there are so many patients and too few workers. From the people that you are talking to, what is the long-term plan, especially since considering COVID cases are ramping up again and hospitalization is going up, or excuse me, what is the short-term plan, if you will?
You know, they have a lot of contingency plans that they did last winter during the wave, like opening up extra wards, moving like we talked about in the emergency rooms. They're moving gurneys and creating, kind of makeshift beds, makeshift rooms. But yeah, the staffing is the problem. Cassie Sauer, the CEO of the Hospital Association, told me it's not necessarily a lack of beds and a lack of rooms. It's more the lack of staff. So with St. Michael's, for instance, what they did is they consolidated everyone under one roof of a place that was larger and did have more staff. So they moved everyone to Silverdale, where at least you have kind of this bigger, better facility that has a better chance of taking care of more people in one spot. So different moves like that, the more you can consolidate people where there actually are more staff members numbers, moving patients to places that can better care for them. But ultimately, what they're asking the public to do right now is to get vaccinated, because that's the single biggest thing that we all can do, and just keeping ourselves healthy in general to help allay, some of this overwhelming demand on hospitals.
Nicole, we appreciate your time. Thank you so much.
Thank you.
Well, that is a, and I know it was kind of hard to listen to because of the technical difficulties. But at the same time, like, this is not just, obviously this is a problem going around the country, obviously happening here locally, and this has been the fear, right? When we start talking about COVID in cases possibly going up higher, we talked about this last year in 2020, and what this can do in some of these towns and some of rural America where you don't have the facilities. Like sometimes, like my old basketball coach, my college basketball coach, who we had on our show, who was on a ventilator, where he lives in a small town, they had to take him an hour and a half away. Right. So when you start having these situations, there's not enough hospitals to, if you will, take care of all of us if we all get sick all at the same time. So this is an alarming problem.
Well, it is, but yet there is such a resistance to believe that it is a problem. And we and everyone else who reports this gets accused of hyping it up. And yet we talk to the doctors who say the same thing. And then you'll see people post on social media things like, well, I talked to a nurse, an entire wing of the hospital is empty. So this is not true. I'll tell you what, as I was talking about this 2 days ago, a friend of mine texted me and she said, I am just leaving a hospital over in Kitsap County in an area where a lot of people don't believe that COVID is real still to this day. And she told me that her cousin, who is only 40 years old, is dying of COVID. Her cousin to this day, even when she was still able to talk, was trying to deny that she had it. But the doctors told her, yes, in fact, she does. And once you get it, and they were hoping that she wouldn't need the vent, but now she does need the vent. I mean, you're talking about a long stay. So it's not like you can just rotate people in and out. And yes, there are this is trauma season on top of everything else. And you were sharing that you have a friend who is right
now, doing all of the has COVID that's turned into pneumonia, and so I'm really praying for him. He and his wife and everything, and he has COVID and has turned into pneumonia at the same time, and so right now they have him on different machines right now to try to help him before the possibility of getting on a ventilator. So I'm just going to think positive thoughts so that he does not have to go on a ventilator.
And we understand it's hard to listen. It's hard. And when we say, please get vaccinated, we're not talking about the people who absolutely really can't for health reasons. Someone reached out to me and said, I'm feeling so guilty because you keep talking about it. We're talking about it for the people who can get it and who can still do something so that they're not texting their loved ones at the hospital bed saying, I wish I'd gotten the vaccine. I mean, it is very real. And if we share the real stories, I hope it changes one person's mind.